And the most common type of auto accident I see is a rear-end collision, where a stationary vehicle is struck from behind, the neck and head are pushed backwards. Then, when the vehicle comes to a sudden stop, the head and neck whip forward, causing a whiplash to the neck and back. When I do an independent medical evaluation, I'm asked to see not only the extent of those injuries, but also whether the accident actually caused or contributed to these injuries. What areas were injured?
It was my neck and my lower back.
I get a thorough history.
Did he take any x-rays?
An x-ray is only going to show us the bones. In addition to the bones in the neck and the back, an MRI scan, which stands for magnetic resonance imaging, will also show us the discs, the ligaments, the muscles, and the nerves. If they've had previous x-rays or an MRI scan, I would like to see not only those results, but I would like to review the films themselves. What usually brings on the neck pain?
I work at a computer all day. Sitting up and turning my neck, staring at the computer, irritates neck and back.
Amy, hop down. I'm going to take a look at your back here. I then go through a thorough examination of the injured areas. Any pain up through here?
No.
Or through here?
No.
No. Is the back pain also worse on the right side?
No.
No. If the history doesn't fit the examination, that should raise a red flag. I also review all pertinent medical records, and if there was a prior history of any injuries, I would also like to see those records.
It's mostly still very painful, and my lower back is still very irritated.
I'm trying to find out if some of her complaints are due to this injury or possibly a previous injury or condition. To complete my evaluation, I summarize her history, summarize my complete physical examination and the x-ray findings, and then come up with a conclusion. And then I will prepare my report for Mr. Kramer, which he'll have in about a week.